In this video, we're going to cover a simple, easy to do, and effective exercise if you're having shoulder pain sleeping at night. Now, I created another video, why do we have pain sleeping at night, where I explain the mechanism, and in that video I promised that I would share an effective exercise. The first one I'm going to show is a little more advanced. I understand you might not have parallettes at home. Later in this video, I'll also share what you can do if you don't have parallettes at home. So these are parallettes. They're basically parallel bars that you can carry around. So there's different variations that you can get online anywhere. But anyhow, if you don't have these, again, I'll show you something that you can do just with a regular everyday chair. So what we want to do is we want to, it's called scapular depression. What that means is pull the shoulder blades in and down. We want to strengthen the muscles that pull that. Remember, if you watch the other video, the humerus down, so we open up that space and decrease the inflammation while you're sleeping at night, losing gravity. So essentially what you're going to do is some variation of this. So you're going to press up, and then what you're going to do is push your shoulder blades down. So right here, this is the full movement. You don't have to dip the whole way down. So press yourself up as high as you can, then relax. You can keep your feet involved. There's different variations. If you want to get more advanced, you can go up into a tuck position. Same idea. That's the whole movement. Next, I'm going to show you how you can do this with a chair at home. Okay, so I want to show you how to do this with a chair at home in the case you're not a CrossFitter, you're not doing a gymnastics program at home or anything like that, and you don't have parallettes, you don't have that equipment, and you don't want to buy it. So what you can use is just an everyday chair with arms on both sides. You want to make sure it's a sturdy chair. You obviously don't want to break the arms of the chair off. But what you're going to do is that same movement. So you're going to press down and then try to pull your shoulder blades down and back at the same time, right? So this isn't the movement right here. We want to push those arms, push the armchair away as much as possible. Start with a 5-second hold. You want to build that up to about 30 seconds in the beginning. We typically start with 5 seconds times 10, so that would be a total of 50 seconds of holding right in the beginning. And then when we work with a person in the physical therapy clinic, we'll work with them up until they can do about 3 minutes, which is that's 180 seconds. So that would be a 15-second hold, roughly 12 times, right? So here, push down as far as you can, push that away. You're not necessarily locking your elbows out, but you're not really doing anything more than just keeping a slight bend there. Push that away as far as possible. All right, and then relax. The reason that we like the chair, and we do that most often in the clinic rather than the parallettes, and again, that's if you're an advanced athlete or something like that, that's great. But the chair is simple. Everybody has it at home usually. And you can use your legs. So realize that the more you use power through your legs and you're relying on your leg strength, the less that you're relying on your shoulder. And again, the extreme would be, if you're putting a lot of weight through your legs, right, it would look something like this, where I'm pretty much standing with my arms here, just going through the movement. The other extreme of that, the other side of the coin, would be to completely lift your feet up off the ground, or you can even go into a tuck position, right? You don't necessarily have to do that to get rid of your pain while you're sleeping at night. Remember, that's what we're trying to do. If you watch that other video, I'll have that linked in the video description below, where we talk about we want to pull that humeral head down. We want to pull that arm down while we're sleeping at night, and the best way that we can do that naturally is to strengthen the muscles that do that. Most people are pretty weak here. If you're going to the gym, if you're using the chest machine, if you're bench pressing, if you're doing lat pull downs or anything like that, you're not necessarily going to hit this muscle really well. So this is an important exercise that a lot of people overlook, even people that go to the gym. So again, we're going to start with 5 seconds, 10 times. Do as much weight as you can, as much pressure as you can, as much work as you can through your arms, and as little through your legs as possible. As you get stronger, you can try to completely eliminate the legs altogether by bringing your feet up off the floor. So when we're talking about a simple exercise, an effective exercise, as a physical therapist, me not knowing your story, you told me that you were having pain while you're sleeping at night and you weren't sleeping with your arms overhead or anything like that, but you had this dull ache. this is probably the first exercise that I would give you to do. Hope this helps. If you have any comments or questions, just leave it below and I'll try to get back to you. Thanks.